Welcome to Heaven and Health Podcast. I'm your host, Angel Polido. Today, I'm with one of the doctors from Queen's Elizabeth Central Hospital, Dr. Chipewa. I hope you guys already know the doctor. So today, we'll be discussing about hypertension. Hypertension is a disease that affects everyone, whether you are young or an elder person. So be there and have an insight from Dr. Pasco. Welcome, doctor.
Thank you very much.
Just remind us of who you are.
So I am Dr. Chipewa and I work with Queen Elizabeth Central Hospital.
Thank you. Today we are going to talk about hypertension. What is hypertension exactly?
So hypertension or high blood pressure is a condition where we observe or we note high readings of BP or high readings of blood pressure of over 140 over 90. So your readings of blood pressure must not be above. So there's a number on the upper side, at the upper limit, which you call it systolic. It must not be over 140. And the number below, what we call diastolic, must not be over 90. So if you have BPs or blood pressure readings which are above 140, the systolic, and above 90, diastolic, on 3 occasions, so we measure you 3 times when you're at rest, and you have readings of over 140, over 190, then we say you've got hypertension or high blood pressure.
What are some of the causes of high blood pressure?
Thank you for that question. So, the causes of high blood pressure are grouped into 2. We have got what we call essential hypertension or primary hypertension, and then we've got secondary hypertension. So, for the primary hypertension, the causes are not known. It's medical knowledge, we call it idiopathic causes.
Which happens automatically.
It just happens automatically. So, and the high percentage of people, 90% of people have got this primary hypertension, which does not have a known cause. The causes are what we call idiopathic medically, to mean we do not know the cause of the 90% of people who have got hypertension. But for the 10% of people, what actually causes them, we group into the causes as secondary hypertension. So causes would be from the kidneys. So diseases in the kidneys might cause high blood pressure. Diseases with the heart and its vessels sometimes can also cause high blood pressure.
What are some of these heart diseases and the kidney diseases?
All right, so some of the diseases in the kidneys will be medically what we call glomerulonephritis. So when the renal tissue or the tissue in the kidneys is actually inflaming or is infected by different causes, but by other causes, that can cause high blood pressure, what we call glomerulonephritis. Also, polycystic kidney disease might also cause, those are renal diseases, can cause hypertension. Also, congenital abnormalities of the kidney and urinary tract, and also chronic kidney disease. If you've got a disease in the kidney which has been there for quite a long period of time, that can also cause hypertension. So those are some of the renal or kidney causes of hypertension. Your question, you also asked about the cardiac causes and its vessels. So we've got what's called coarctation of the aorta. So there's actually a tube, what we call it an aorta. It takes blood from the left ventricle to the whole body system. So if it's narrowed at some point, that tube, the aorta, can be narrowed at some point. So when the narrowing happens, that also can cause high blood pressure, bleedings.
The aorta carries oxygenated blood, right?
It does carry oxygenated blood to the whole body. Sure. So I was just saying that in secondary hypertension, that hypertension would be caused by disease in the kidneys, as well as I mentioned, disease with the heart and its vessels, but also would be also some of the endocrine diseases. For example, pheochromocytoma, gangliomas, hyperthyroidism, and Cushing's syndrome. Now, these are medical.
And these are diseases that attack.
These are diseases that attack that are from the endocrine system. Yes, and also some drugs, of course, can cause hypertension. For example, steroids. Use of steroids could actually cause hypertension, and some tumors also in the body. For example, Wilms tumor, neuroblastoma, and adenocarcinoma. So these are some of the causes of groups of causes of hypertension. Yes.
Are those the only causes? Because we also see that diet also take a big role in causing high blood pressure.
Okay, so diet, those would be some of the factors. Also, we call them risk factors. Things that would put you at risk of getting hypertension. They may not, in themselves, may not cause high blood pressure, but they actually predispose you, or they make you susceptible. They'll make you prone to have hypertension. But in and themselves, they do not cause hypertension.
So what are some of the foods?
All right. So some of the diet that would actually cause, that would make you susceptible to have hypertension is, of course, high salt intake, for example. If you take a lot of salt in your diet, you'll be at risk of having high blood pressure. If also you drink a lot of alcohol, if you drink a lot of alcohol, you're also going to be at risk of getting high blood pressure. If you also smoke, you'll be at risk of hypertension. And also, if you take diet which is higher in fat content, you also be at risk of hypertension. Yeah.
What about sugar foods? Don't they contribute? Don't they also put you at risk of high blood pressure?
So sugar foods like what?
Maybe chocolate, cake, something that contains a lot of sugar.
They do not really predispose a person to hypertension.
Okay, so when a person is sick, he or she reaches some of the stages that the person maybe cannot normally exact to know that this person has high blood pressure. Every disease has stages where you can determine that this the stage where the person can be at risk, and you can say that this person cannot be at risk. So what are some of the stages of hypertension?
All right, thank you for that question. So there are actually 3 stages. We have what is called mild, that means it's minimal, mild hypertension, and we've got what we call moderate. Moderate, that means it's in between. And we've got what we call severe hypertension. That's it's worse. So for the mild one, your upper pressure, what I described as systolic, must be within from 140, the upper one, to 159. So if it's 140 to 159, we call that's moderate. What's the diastolic? In the same range, must be from 90 to 99. So it means you've got mild hypertension. You are hypertensive, yes, but it's mild. Whereas for moderate, the systolic must be from 160 to 179. But the diastolic, the one below, must be from 100 to 109. That's moderate. But when we say this is severe, this is worse, then the systolic, or the number above, is over 180. But for the diastolic, is over 110. That is so severe hypertension. Sure.
What are the signs and symptoms that a person shows?
So occasionally, most people that are hypertensive, they will not have symptoms. They are symptomatic. They walk just like anybody else. But some of the symptoms that they can present with are occasional headaches. So they'll be feeling headaches. Sometimes they'll be feeling palpitations. So palpitation is when you're aware of your heartbeat.
feeling every time your heart beats.
Yes, normally you don't have to feel your heart beating, but when you are actually aware and perceiving your heart beating, so we call that a palpitation. It's a sign of hypertension. Dizziness, sometimes they just feel dizzy and have what easy fatigability. They do some small work, they feel tired, just feeling weak. So those are some of the signs and symptoms that will actually point a person to have hypertension. So if people are presenting those plus the higher leadings themselves of pleasure on 3 occasions, we call that, then we'll say you're hypertensive. So those are some of the signs and symptoms.
Is a person who is obese at high risk for high blood pressure?
Yeah, a person who is obese, they are at risk, of course. They are at risk of blood pressure. But the risk is not that high, but they are at risk.
So it also depends on how obese they are.
It also depends how obese they are, but obesity is not one of the major risk factors of hypertension, unlike things like high salt intake, for example, alcohol and smoking, which are
very risky.
Very risky in hypertension or in blood pressure.
So what are some of the complications that occurs in a person due to high blood pressure?
Thank you for that. So people might have what are called hypertensive crises. So they will come in the hospital very sick, having great headache and sometimes blurring vision. So what we call hypertensive crisis, they just come in a very sick condition. That's the first thing. The second thing, complication, is hypertensive retinopathy. So hypertension can actually destroy some of the vessels that supply your eyes, and eventually you might not be able to see properly. Other people actually develop into blindness.
Oh.
Yeah, it's that bad. So hypertensive retinopathy. And there's what is called hypertensive nephropathy. So the high blood pressure itself can actually destroy your kidneys. Destroying the kidneys, and then when the kidneys are destroyed, those are just worse states.
Yeah, having a kidney failure is something else.
Exactly. So acute kidney failure and sometimes chronic kidney failure, but that also can result from hypertension if it's not controlled. So these complications, they come in if people are not controlling the blood pressures, using the medications and sometimes the lifestyle changes. The other complication which comes is hypertensive cardiomyopathy. So things like heart failure. Your heart eventually does enlarge, what we call, sometimes hypertrophy, and eventually you might go into heart failure. So the heart failing, it's very common. We actually see lots of patients like that.
Yeah.
Lots of patients are presenting heart failure because of hypertension. So, and the other complication is which is common is a cerebrovascular accident, what is also called stroke. So vessels in the supplying the brain might actually rupture. So they will rupture, and then some blood gets spilled in the brain matter, and it's a deadly state. Most people die of hemorrhagic strokes. Another stroke is ischemic. Sometimes there's a clotting in the blood vessel, and the blood does not actually leach some of the brain matter, denying them of oxygen and food nutrient. What we call ischemic stroke. So all these result from hypertension. So it's that bad. It's really bad. So if it's not controlled, that is.
Are there any other complications?
Mainly those are the ones.
What are some of the challenges do you face when treating hypertension patients?
Great. You want to know how we actually treat? So that you should appreciate the challenges that we face.
Yeah, you're going to ahead with that.
Thank you. So treatment-wise, we approach it in two ways. The first one is non-pharmacological. So non-pharmacological means we do not. This is the kind of treatment where we are not initiating medications. We are just initiating lifestyle modification. So we advise them to say reduce your salt intake. If they smoke, they must stop smoking. They must do exercises. So any kind of exercise which will actually make you, produce, sweat, like just brisk walking, just walk a bit, but I should actually produce sweat. Can be for 10 minutes or 30 minutes in a day. And also we tell them to lose weight. You talked about obesity, so tell them to lose weight and to avoid excessive alcohol consumption. So we prescribe those non-pharmacological measures, and then pharmacologically we provide drugs. So there are steps how we do it. So we start with a medication, what we call hydrochlorothiazide, for example, thiazides. So from there we go to calcium channel blockers like nifedipine and amlodipine. We also give them some medication like angiotensin converting enzymes inhibitors. So those are some of the medications that we give the patients.
Can you explain for us this stage?
Okay, so step one, we involve thiazides. Like the example of it is the hydrochlorothiazide. So we give hydrochlorothiazides to take them. It's a 25 milligram tablet that they must take it each morning, or once daily. Now, thank you for that question. How many days? When we are prescribing medications for antihypertensives, these are taken for life. There's no point.
So when you stop drinking your medications, you are also doomed.
When you stop taking the antihypertensive medications, you are doomed, just like you said.
Oh.
It may not appear, like I've told you, that these are most of the patients are asymptomatic. They don't produce symptoms. It may appear momentarily that you're okay, but eventually complications develop. So these drugs, you take these drugs for life, throughout life. And so that actually comes to what you asked me about, the challenge that we face when we are treating complications is actually that, to make patients understand that they need to take these medications for life. Some patients are just tired.
Drugs are tiresome.
Of course. Drugs are really tiresome.
And sometimes you can end up forgetting taking your medications.
Yeah. Sometimes you can actually forget, as you put it. Everyone forgets. But where you intentionally stop taking the medications despite being told to be taking the medications, then things go wrong. So I think we tend to understand patients, and we tell them we understand that this is tiresome, but please take the medications, because taking the medications versus the complications that might follow, what is worse is the complications. So
you as a doctor, don't you think they should be raising awareness?
Great. We should, and we must be raising awareness, and there are already avenues where that is happening. I think when the patients come to the hospital, they're actually fed with relevant information on hypertension. Most of the people with hypertension, actually, they know a lot of things. They know a lot. They already know. And so is with most of the chronic conditions. People know, the patients, they know more about the conditions. But I think sometimes it's just the willpower in the patients. The energy, like you said, they're tired to be being followed up in clinics, because we actually also follow up these patients in clinics. So we have to be raising the awareness, and even avenues like this podcast, it's actually raising the awareness in maybe radio stations. Of course, also when they come here at the hospital, we do provide the information about hypertension to these patients.
So how are you planning to reach people in the rural area to have this information?
All right. Well, thank you for that question. Um, personally, there are other places where I actually disseminate this information. For example, there are lots of initiatives where people go to do BB checks. So they will do BB checks maybe in churches, BB checks around some shops. Of course, part of it is for fundraising, but part of it is also is to disseminate the information. But going into the rural areas, I think that is something that we need to consider. It hasn't been in the forefront of our head, but something to consider, taking this in the rural areas.
Yeah, because I know that most people focus in the urban area, live in the rural area.
Yeah, that's really true. It's food for thought for most of us who are in the medical practice to consider taking this to the rural areas with or without funding. Just use the passion, the passion that we have, and get this information disseminated.
So you also like the power of money.
Come again?
I mean, the power of money also controls you guys that you should do this and you should do this.
You know, money controls everything.
Yeah.
Money controls everything. If we had enough money, let me use the word enough, not a lot of money, because I mean, how much is a lot and how much is enough? But then when
money is never too much.
Money is never too much. I agree. And does it reach a point where people can say this is enough?
No.
Yeah.
Even if you have billions in your house, you still say that I want to find more money.
Yes, but then there's actually some amount which is better off, which is a comfortable amount. I think if such amounts of money, are available, I think some of these initiatives would be easier. I know the hospital gets the funding. I know organizations and institutions that get fundings to do these things, but money is not always enough to fund activities which would have take such messages across the country in each and every district and area. Of course, the rural area where people are staying, it may not just it may not just happen. But if there's a good funding, such activities can actually accelerate and lead to those rural areas. Sure.
Why can't you just create an activity and fund the money for yourself and use it to disseminate information?
Yeah, you're right. And
because it's a matter of helping people.
It's a matter of helping people. Yeah, and I think this era, the era of research and dissemination, I think we are seeing much of that. People having ideas, people seeing gaps, and being able to source funding, because funding sometimes is available, and people now going out to do that. We should also be able to do the same. Seeing these gaps and then going out there to seek funding, and then go out and disseminate information. When we have the time, sometimes we don't just have all the time, but when we create time to do that, sure. And that is actually covered in public health. So they say there's a clinical aspect where we see patients, and then there's public health where people go out and engage with the healthy people, engage with people that are not present in the hospital. Sure.
But I was thinking that you guys shouldn't be relying only on funding, because everything starts with you. And if you're not willing to start that thing, who's going to find you? Who's going to fund you? Because if you start this little something that you're creating, maybe you've created a group of doctors doing all such activities, people will be motivated and be like, let's help these guys.
You are right. It actually begins with us. And like I said, there are already initiatives in place, spearheaded by the branch of medicine, what we call it, public health. So public health, they go out and deal with healthy people so that they actually prevent. One aspect of public health is prevention of diseases. And it's happening. it's happening. But we need just to scale up such initiatives, by which I agree with you. We need to scale up such initiatives and yeah, meet the demand out there. Yeah.
So what kind of advice can you give to people?
Thank you. So my advice, first of all, to patients, people that are hypertensive, I want to reiterate what we tell them in the hospital setup, to say, if you are hypertensive, please reduce salt intake. Stop smoking if you are a chain smoker, or if you just smoke casually, in a casual way. Stop smoking. They must be doing exercises, and if they are overweight, they must lose the weight, and also avoid excessive consumption of alcohol. And for those that are on medications, I want to encourage them to continue taking the medications. That's my advice. Because we see most of the patients already in worse state of complications because they were not taking the medication. So my advice is, if you're on antihypertensive, please take the medication. It will actually do you more good than harm. I'm also advising these ones to be actually coming to the hospital for follow-up. So they need to be coming to the hospital so that we follow up with them if they're developing complications, like if their eyes are being affected, if their heart is being affected, or if their kidneys have started to be affected. We do that in the clinic, month 3. So they need to be coming to the hospital month 3. What's for the general population? I would advise that if they have got people that have got hypertension, let these people, encourage, let them support them. They can support diet-wise. They can support the patients take the medication, that they can support them, make sure that they come to the hospital. Yes. And also themselves, the general population, if they're actually suspecting to have hypertension, please, they need to come to the hospital early, so that we see if they really have hypertension and then manage them. Yeah, that would be my advice.
On your advice, where you say that people should stop drinking and they should stop smoking, what about for the guys who are addicted? They can't do it or without smoking or drinking. Means we have seen other people being advised at the hospital that just continue drinking, continues maybe doing something like that.
All right. So when it reaches a state where somebody cannot do without either smoking or alcohol,
maybe some persons, they just start shaking or doing something like that.
Yes. We call such, alcohol withdrawal syndrome. So that is also a whole spectrum of mental disorders, what we call alcohol and substance abuse disorder. It's a mental disorder. So for those patients, if they are too much addicted, they can't do without, they need to come to the hospital. So in the mental department, we are going to help them so that they should actually minimize or stop completely, because these are some of the things that put these people at a higher risk for these conditions. We would want them to actually stop or minimize. And if we know that it's in a state of a disorder, we redirect them first to the mental department, psychiatric department. When they are dealt there, they are referred back to us to continue managing them.
We have heard from Dr. Chipewa that hypertension is a killer disease. So don't hesitate. Go to the hospital. Take your medications. Don't feel tired of taking them, because if you stop, you're going to die. Thank you very much.